Hello and welcome to the BlueLENS application for the Cognitive Hackathon from the Dublin Research Lab. Care management is critically dependent on collecting and providing the right information to the right people at the right time across the care continuum. This information is multisectoral, comprising medical, psychological, behavioural and social factors, while the right people come from a variety of disciplines such as nurses, doctors, social workers, care assistants and care managers. These professionals operate at diverse points of care, such as referral, intake and discharge, in both the healthcare and social care sectors. In this demo of our application, we show BlueLENS and how it gives care workers a customizable, context-sensitive and queryable 360-degree view of a patient, including medical and demographic information, social interactions, services received and more. It also allows care professionals to insert notes, either using a keyboard or by using text-to-speech capabilities that are automatically classified and organised in this 360-degree view. For this demo, we are focusing on Teresa Taylor, an elderly client in the care system, and Maria Ward, a new care worker that has been added to Teresa's care team. Maria is on her way to meet Teresa for the first time, so she decides to use BlueLENS to get an overview of Teresa. She can see where Teresa lives and the demographic information for this area, in addition to all other relevant information such as her medical conditions, social network, medications, services, etc. All the information is presented in BlueLENS as cards, and these cards are ranked and reordered intelligently as we browse through the 360-degree view of Teresa. While getting an overview of Teresa, Maria notices that there is important information in the domain view of Teresa. This is denoted by a yellow alert icon. In the domain view, Maria can see the biological, psychological, functional and social views of Teresa, and again she can see that the important information is in the social view of Teresa. In the social view, she can see that there is a drop in the number of interactions between Teresa and Sandra. Maria then decides to take a look at Sandra to see who she is. Sandra is Teresa's daughter. We can see this in the social network card. And Sandra suffers from depression and anxiety, along with other issues. Maria decides that she should ask Teresa about how things are going between her and Sandra when she meets. We will now jump forward to when Maria meets with Teresa, and Maria asks Teresa how things are going with Sandra. Teresa tells Maria that things are not going well between her and Sandra, and Teresa says that she herself is becoming very anxious and Sandra is getting stressed. At this point, Maria decides to create a note in the system to record this. She does this by dictating the note to BlueLENS. Relationship between Sandra and Teresa is difficult because Teresa is becoming very anxious and Sandra is stressed. At this point, BlueLENS is using the natural language classifier to tag the note, and it is using Alchemy API for sentiment analysis of the note. The note is saved to the system along with its tags and sentiment so that the care team can easily find it later. Teresa now tells Maria that she is feeling bad with the new drugs that were prescribed for her, and in particular she is getting some abdominal pain. As Maria is not that familiar with Teresa's medicine and the side effects, she decides to ask BlueLENS for help. She asks what are the side effects of Teresa's drugs. Behind the scenes, BlueLENS not only has to determine Teresa's drugs, but then it has to link it to the information for known side effects from these drugs. It does this by using knowledge graphs, and it re-ranks the cards based on the entities we get from the IBM.next queryable asset, question answering system. After BlueLENS answers the question for Maria, she tells Teresa that it is quite a normal side effect and not to worry. Maria also decides to add this as a note to the system so that the doctor can see it. This concludes the demo of the BlueLENS Cognitive Hackathon application.